Did you know that Alzheimer's is now one of the leading causes of death in the UK? Right now, around 900,000 people in the United Kingdom are living with dementia, and most of them with Alzheimer's disease. And globally, over 55 million people are affected. And unless we act now, that number could reach 139 million by 2050. And those numbers are not slowing down. They are accelerating. But why are the numbers rising? Why are they rising? One of the biggest reasons for this increase is simple. We're living longer. Age is the biggest risk factor for Alzheimer's. And here in the UK, people are living well into their 80s, 90s, 100. The population is aging fast, and with age comes higher risk. But it's not just about getting older. There's lifestyle factors like heart disease, diabetes, obesity, and even social isolation. They all contribute. And while we have a strong NHS, early detection and consistent dementia care still vary across the country, especially in undeserved areas. And in lower income countries, it's even harder to access support, and cases are rising even faster. The emotional and human cost of all this is incredible. Every number represents a real person. Someone's mom, someone's dad, someone's sister, someone's brother, someone's husband, someone's wife. And the impact on families is enormous. Many people with Alzheimer's lose the ability to recognize loved ones. They lose the ability to manage daily tasks or even speak. Family members often become full-time carers, unpaid, unsupported, and emotionally exhausted. And in the UK, around 700,000 people are informal carers for someone with dementia. Alzheimer's takes away a person bit by bit. This is what makes it such a cruel disease. Do you know how much dementia costs the UK? Do you know? I'll tell you. Dementia costs the UK £42 billion a year, and that number is rising. That includes healthcare, social care, unpaid care, and the impact on employment. And with more cases expected, the pressure on families, on care homes, and the NHS is only growing. It's already the biggest health and care challenge that we face here in the United Kingdom. And unlike cancer or heart disease, there's still no cure. There's no cure for dementia. So what's being done? There's hope. There is hope. There are new treatments like donanemab, and they've shown promise in slowing cognitive decline, especially if caught early. Research is also exploring AI technology. AI technology will help detect dementia earlier through sleep patterns and speech analysis. And we now know that up to 40% of dementia cases could be delayed or prevented by addressing modifiable risk factors. And what are those? We spoke about them in a previous video. Quit smoking. Quit alcohol. Stay active. Reduce loneliness. Speak to people. You also have the shingles vaccine. And the shingles vaccine has been shown to have protective properties for the brain, or protective effects for the brain. You don't need to be a doctor to make a difference. What you can do is learn the early signs of Alzheimer's. And I'll go over them so you know, just to jog your memory. It's memory loss, confusion, trouble with daily tasks, personality changes. Start conversations early and check in with older loved ones. And if you're caring for someone with dementia, please, please don't do it alone. There are support groups, helplines, local charities across the UK. You deserve rest, help, and a listening ear. So in closing, I just want to say we may not have a cure yet, but awareness is powerful. The more we talk about Alzheimer's, the more we break the silence and push for better care. This isn't just a health issue, it's a family issue, a social issue, a human issue. So please, like, share, subscribe if this has helped you in any way. Together, we can build a more dementia-aware society, one person at a time. And remember to be kind.